So today's healthcare in Connecticut. I'm John Collins. I'm the Democrat running for state representative in the 55th district, which includes Andover, Bolton, Hebron, and Marlborough. And I'm so happy to have Congressman Joe Courtney here to talk about that today. Little biography for Joe. Certainly doesn't do justice to everything he's done, but Congressman Joe Courtney was elected in 2006 by 84 votes to represent the 2nd Congressional District of Connecticut in the House of Representatives. He serves on the House Armed Services Committee and the House Education and Labor Committee. He is a senior member of the Armed Services Committee, and he has worked to strengthen our nation's defense by leading the call for increased submarine production, and that certainly has happened at Electric Boat. So we should all thank Congressman Courtney about that. Something a little bit more, well, important to me, that's important, but he's dedicated to preserving our green space and protecting the environment. He's introduced one passage of a law that designated 8 Mile River in Connecticut as part of the National Wild and Scenic River System. Thanks to his efforts, this pristine and scenic watershed will be preserved for generations to come. Before serving in the House of Representatives, Joe Courtney represented the citizens of Vernon in the Connecticut General Assembly from 1987 to 1994. He's a 1975 graduate of Tufts University in Boston. He earned a law degree from the University of Connecticut School of Law in 1978. He lives in Vernon with his wife, Audrey, and his 2 children, Robert and Elizabeth. So Congressman Courtney, welcome.
Great, thank you, John, and congratulations to you on your nomination. I think 2020 is an election for the ages, and you know, obviously we've got a lot of work to do in the next 85 days or so, but I'm feeling very good about, you know, what's out there right now in terms of public opinion and the desire for sending people like you to Hartford.
Thank you. So I want to, before we start, I just want to thank you for something you don't even know about. My dad was a lawyer. You may have known him, Bill Collins. And he was a fighter pilot in the Korean War. He flew 74 missions. He got the Distinguished Flying Cross. And then he became a lawyer and worked in Manchester. But he got Alzheimer's about 20 years ago. And there came a point when my mom couldn't take care of him. And we wanted to get him into the Veterans Home, which is a really excellent place for Alzheimer's people. There's a waiting list, and you shortlisted it, and he got in. It was a gift. And he had your picture with him on it the entire time he was there. So I really want to thank you for that.
Well, he, was one of my favorite people, back in the day when I was practicing law in the area there, and just a really, decent, honorable, good guy. And I think, as you point out, I mean, the VA system, which takes a lot of hits out there, certainly at the Veterans Home in Rocky Hill, where they built a state-of-the-art Alzheimer's unit, really, he was very well cared for, and you could see it when I went to visit him. He was just in a really good, safe, clean, healthy place. And again, the family was always there. You guys were incredibly supportive of him.
Yeah, thank you. Yeah, the nurses were great. He loved the nurses. He loved the entire, it was a very good situation.
Right.
Let's start off. Let's just talk a little bit, start off with the U.S. healthcare system. So the first thing I think we should probably talk about is how the healthcare system is different now with Obamacare as compared to before when we didn't have Obamacare. What has Obamacare done for us?
So, back in the day when I was in the state legislature, I actually chaired the Public Health Committee in the, late 80s and early 90s, which is, when the Clinton healthcare plan was trying to, obviously cover more Americans, and kind of unfortunately faltered, and we weren't able to get it done. Obviously, I was in the Congress in 2010 when we passed the Affordable Care Act. By the way, the last speech that we heard before we went to the floor to vote in the House of Representatives was from John Lewis, who, again, reminded us that, at some point we're there to act, and history watches us, in big moments like that. And again, it was just another one of these amazing experiences of John's, footprint that he left in this country. And but anyway, I mean, if you look at what the healthcare system looked before we voted on that, and President Obama signed it into law in March of 2010. Again, the insurance market, which covers still the majority of people in this country, was still riddled with all kinds of gaps and, just discrimination and unfairness for people with pre-existing conditions. We had insurance policies that had lifetime limits, so that somebody with a chronic illness or a cancer or whatever would basically max out. And so bankruptcy due to healthcare bills was just rampant throughout the country, and no one was safe, in terms of just the sort of basic levels of coverage. So if you look at the ACA, it's actually the Patient Protection and Affordable Care Act. That patient protection in the title was basically about all of these reforms that changed the marketplace. It's obviously, we have much more work to do, but again, at least there was a basic structure in place that people, again, would not be denied coverage. They would not be redlined. They were the way they were before, or that their insurance would suddenly just disappear when they really needed it. We also expanded Medicaid, and that obviously is a federal state program that covers low-income people. We got rid of all the categorical eligibilities and just expanded people's ability, whether you're a single adult or a pregnant, expecting mother, or an elderly person. And again, if you step back today, roughly about 20 to 30 million more Americans are now insured because of the different provisions that have been included in the bill. President Trump has done everything he can to sabotage that law. I mean, and frankly, he's still at it in the middle of a pandemic. And obviously, we need very strong leadership at the state level to make sure that progress is not lost.
I agree. I mean, what it's done can be measurable. I mean, we look at Kentucky, there's statistics that show that longevity of life has increased in Kentucky due to healthcare, due to Obamacare. Although I don't know that the residents know it's Obamacare. I think they think It's Kentucky Care. Yeah, and John Lewis was a hero. I mean, a true hero, somebody I looked up to, and what a tremendous American, I think. Can you talk just a little about how the HEROES Act has impacted healthcare?
So, obviously in the middle of a pandemic and the recession that has unfortunately, been triggered by the pandemic, the fundamental pathway out of this, crisis that we're in right now, obviously, because it is being caused because of a healthcare, origin, is that we've got to address that. I mean, that is fundamental to really getting this country on the other side of the pandemic. And there's clearly a desperate need for a lot of the tools that our healthcare system needs in terms of, testing, protective gear for our healthcare workers, which is still very shaky. And, we obviously need to make sure that as a country, we're using every tool available, both financial, but also, using the Defense Production Act, which is a law that basically gives the federal government the ability to boost production of critical, necessities at a time of crisis. Again, Trump did use the Defense Production Act for production of ventilators, and we're actually in a pretty decent place as far as that goes. But in terms of, he has still refused to do it in terms of the test kits that we need if we're going to have a system of, really isolating the coronavirus. And so the HEROES Act basically provides the resources for testing, tracing, the boots on the ground that you're going to need to really do it the right way. And again, the countries that have succeeded, whether it's Germany or New Zealand or South Korea, I mean, they we know it works. And the problem is that we've got an administration which has just willfully, refused to do that. So the HEROES Act provides those resources. It also directs the president to use the Defense Production Act to really boost production so that we have adequate test kits to get us to that point. It provides resources for development of a vaccine. But again, once you get a vaccine that you feel reasonably confident works, then you got to get everybody vaccinated, which is a whole nother sort of undertaking that is going to be very challenging, with a country of over 300 million people. So, again, the foot dragging, the denial. The president on Saturday once again said that, the virus is going to just disappear. Incredibly, given the fact that we're watching, the numbers continue to climb. But again, the HEROES Act provides that. Lastly, I would just say that the HEROES Act also provides state and local assistance, which is really fundamental to making sure that public health programs at the state level and at the local level are adequate, that our public school systems have the resources so that they can safely open or operate remotely, depending on whatever is the appropriate system to move there, and even public safety. Just that all of those are going to be really challenged as revenue collapses due to the recession caused by the pandemic. And the breakdown in negotiations, which took place on Friday, unfortunately, really does center around that state and local piece that we have in the HEROES Act. Speaker Pelosi is crystal clear that she's prepared to negotiate, and no one really expected us to get the full package. But basically, Mark Meadows, who's the president's chief of staff, basically, doesn't believe in this stuff. And I know that guy because he was in the House.
Right.
7 years. And,
he's part of the Freedom Caucus, right?
Right. And in the 2013, some of you may remember, we had a government shutdown. It was the longest shutdown since the 1990s. Mark Meadows was the guy who triggered that shutdown because he demanded that we repeal Obamacare as a condition of reopening the government.
Right. He's a fringe guy, and he's the chief of staff.
No, Mulvaney was bad enough, but this guy takes it to another level.
So you're mentioning the lack of leadership from the Trump administration and how it's really exacerbated the COVID pandemic. And one of our credos for the campaign is facts, fairness, and fiscal responsibility. And so we're coming out with facts, which are so important in actually, solving crisis and problems. And something I don't think that the Trump Republicans really believe. You talked about about healthcare workers and how they're often victims of violence in their workplace. I know that you sponsored some legislation to protect that. Yeah, can you talk about a little bit about
Sure.
that?
So, actually, this has been something we've been working on for almost 7 years, because really we have been hearing more and more from frontline healthcare workers, whether the ones working in emergency departments, EMTs, folks in particularly behavioral health treatment facilities, about the incidents of assaults and injuries, which we had the Government Accountability Office actually do just a comprehensive study across the country. It took them 3 years to come back with their data, but unfortunately it confirmed the worst of everyone's fears in terms of, right now that is the sector in our economy where people are the most vulnerable and prone to really, in some instances, pretty gruesome injuries. So, we had legislation, HR 1309, which I introduced and managed on the floor about a year ago that we passed it. But it basically set up a national enforceable standard, again, using best practices about ways to reduce risk for people who, again, are working in emergency departments where they have got buzzers and are not left alone, that they identify high-risk patients. And, there's ways that you can do this. This is not, mission impossible. And again, we had a very broad cross-section of healthcare providers, from emergency docs who, again, the statistics in terms of the number of injuries that people working in emergency departments it's really stunning. A lot of it's being driven, by the heroin opioid, crisis in terms of just, patients who are very difficult to control. And again, that's why you really need to train people and give them the tools they need to protect themselves. The burnout factor for people in healthcare because of this is really something that people should really sit up and pay attention. And frankly, the COVID, pandemic is adding to that burnout factor that we really can't afford right now.
Yeah, I know a couple that were talking with me just as the COVID crisis came in. Both are nurses and they work 2 shifts and they've got 2 kids. And so, and they were scared to death that they would get it because they don't have childcare.
Right.
And so that was a huge issue. So before we get on to prescription drugs, I would like to go back to the stimulus and talk about the stimulus we're talking about now. It hasn't been passed, and the effect on municipalities, because we need help out here. If we don't get significant help out here, it's going to be a huge crisis. I'm glad to see that Speaker Pelosi, who I admire greatly, is working so hard on it. But can you just tell us, what kind of numbers are we talking about?
So, again, if you look at a town budget, like the towns that you're competing in right now,
right.
Obviously the pie chart, in terms of where revenue comes from, for schools and for local budgets, obviously the property tax, which is not a very fair tax, and really creates lots of sort of negative ripple effects, is still the workhorse for a lot of municipalities. But again, state aid is critical in terms of particularly public education. And when we know this from the 2009 recession, was that as that, continued to just, go on a downward cycle, the impact in terms of the state's ability to maintain local budgets also deteriorated badly. So, we've got the data that shows that, as the state of Connecticut sees a loss of income tax revenue, sales tax revenue, lots of other revenue that's related to economic activity, that is going to put a tremendous downward pressure in terms of maintaining the education cost sharing program, which is, again, that's the other workhorse in terms of paying for schools. So the bill that we passed in the HEROES Act, again, set up, and it's a big number, but it's $1 trillion over 2 years. Again, this is to create a long horizon, so that provides real stability for state governments and local governments. And again, half of that goes to the state and the other half goes to local communities. We made it specifically clear that communities of populations of less than 50,000 get direct payment. It doesn't pass through Hartford. It doesn't pass through any state agency formula. These are direct payments to,
that's great.
Yeah. And so, because that's always been sort of the complaint, particularly in small towns, is that by the time the money comes in from Washington, it's like the old man of the sea, the fish is gone by the time it reaches the local level. And that was something that, a lot of us who represent sort of more rural suburban areas were very adamant had to be a part of. So there actually is a calculator. You can go online and look up your towns, and they'll tell you what the HEROES Act provides for each one of those communities. And Brian Coughlin from my campaign is on board the call here, and we can make sure to get that to you guys. Oh, he just put up on the screen, Marlboro.
Putting it up in the chat right now. Yeah.
Right. Which obviously would take tremendous pressure off of. And by the way, towns can't use that to cut taxes. It's about maintaining services, which is, that's the whole point of this, which is to keep the lights on in terms of critical services.
So we, when I was elected, the property tax had gone up from 10 years ago to 37.44. And so the Democrats that reduced the property tax here. We demanded, because
that's impressive.
It was based on, not on the schools. The schools maintained or increased their funding. It was based on the town budget, because we can't, it's not sustainable. We can't have 37.44. We won't get, new people coming in. We won't, it's impossible. So, it's down to 36.33, which is, is okay. And if we get aid and keep it at 36.33, maintain the town budget, that would be wonderful. That would be tremendous help. And I just want to say again, it's the Democrats in Congress that are doing this, everybody. The Republicans are telling us to go bankrupt. I mean, that's
Right.
basically what they're saying.
Mitch McConnell said it on a radio show.
Right,
Yep.
exactly.
Yep.
And they're talking specifically about Connecticut and Illinois. Go ahead, go bankrupt if you think you can, although it's not constitutional.
Right.
So let's get on to prescription drugs. It's a topic that's always a question. We all need these drugs. The drugs that we have now are phenomenal, many of them, and they're life-saving. Why is it that our drug costs, prescription drug costs, are so high in America as opposed to, say, Canada and other countries?
So the Organization of Economic Development is an international, sort of data collection system that works through the UN. And they actually have a chart, which I'll pass along to you maybe after the call here. But it shows where the U.S. stands versus other developed countries in the world in terms of prescription drug prices. And it is sickening to look at that graph because the next highest country is Switzerland, and their costs are 25% lower than the U.S. across the board. So you've got these crazy situations where things like insulin, which has been off patent for decades, again, costs hundreds of dollars, where in the UK you could buy the same number of units for $10.
Right.
And it's not because the government in the UK is subsidizing it, it's just that's what it costs to actually produce it. And so HR 3, the Elijah Cummings Prescription Drug Cost Reduction Act, which we passed in the House, in my opinion, does what is pure common sense, which is it allows the government, which is a big buyer of prescription drugs through the Medicare and Medicaid system, to use that leverage to negotiate a better price. Again, using as a baseline sort of the average international price for different medications. If this bill passes, we will still be on the higher end compared to other parts of the world, but vastly better in terms of what we're paying for today. So number one, the government obviously saves a ton of money, and it frankly helps Medicare solvency, which is a real issue right now because the last trustees report shows that we are starting to get close to the tipping point, in terms of Medicare solvency. And but even more importantly, the bill extends that benefit of a lower price to also private health plans. So again, it's not just for seniors and people who are on public assistance health programs. It would extend that lower cost to private health plans, which again would provide lower costs for those plans in terms of deductibles and premiums. Again, we had an incredible coalition of groups that came and supported the bill. A little controversial in Eastern Connecticut. Pfizer down in Groton is a major employer down in that region there, and I had a town hall with the employees there, which was very interesting. But the fact of the matter is, they're very smart people that work there, and when you show them the data and you compare and what this means to American taxpayers, American workers who again have to spend more in terms of their health plans. The government is not stingy in the U.S. in terms of providing assistance for research and development. We basically have a R&D tax credit, which pretty much allows those companies to deduct the costs of their R&D, which is fine. That's a good activity that you want to incentivize. If you look at just the vaccine development for coronavirus, billions of dollars are being
the startups and others. Yeah, that's
right. So it's just it obviously ran into a stone wall with Mitch McConnell in the Senate, who is just totally and just got farmer has them wrapped around their finger there. It is definitely on the ballot this fall in terms of trying to get this done. If you look at the polling on this issue, it is off the charts, and it extends to Republican voters as well as Democratic voters, because people are just fed up with paying for medications that, again, they're not even on patent,
Right.
like insulin. So the Connecticut General Assembly just did an insulin bill, and
Right.
and
The
we need
path.
people like you there, John, to make sure that that fight happens in the state level as well.
Well, not to, my opponent missed the special session. I would have voted for it, obviously, but she
Yeah.
wasn't there. So,
Wow.
um, yeah, it's odd, the economics of pharmaceuticals in the United States. First of all, I mean, if pharmaceutical companies can compete in Canada with lower prices, why can't they compete here?
Right.
Number two, we've set up a huge infrastructure with NIH that actually develops a lot of these drugs, if not most of these drugs. Right now, the drug companies are coming out with new products that combine really drugs. They aren't doing a lot of new development except for this COVID-19 vaccine. So yeah, so I wonder about that. But then the third thing is the idea that we can't use our collective buying power to lower the prices, that the Republicans always block that, to me is anti-capitalist. I mean, it's why can't we, do that? And why are we protecting these large corporations? Make them compete, make them become capitalist and innovative.
No, and again, if you just go into other areas of the federal budget, the government is, big into the business of acquisition. Obviously, the Department of Defense is a perfect example of that. And when they negotiate, whether it's a new, F-35 contract or Virginia class submarine contract, I mean, they do hard negotiations, and they use, good old fashioned competition in terms of
Right.
putting it out to bid, and
Right.
but there is actually an anti-negotiation provision in the law when the Republicans passed the Medicare Part D law back in 2004, I think it was, or five, that actually by law prohibits the Department of Health and Human Services from negotiating, and obviously HR 3 repeals that provision.
So, I was thinking about this last week as I sat in darkness. The Democrats are really the party of entrepreneurs and of good capitalism. And I was thinking, in terms of pharmaceuticals, but also in terms of Eversource, this is not an innovative company. What have they done that's innovative? What makes us believe that they are going to give us the best product or service? And that's something I want to demand, in the next months as we come along. What are you doing as a company that's innovative, that's good for the consumers, for the citizens of our towns and of Connecticut? I don't see a lot. I mean, I see wires on the poles as we wait for storms to knock them down, and I see tree cutting, and then that's Eversource, and then I look over and I see Tesla, and they've got world-class batteries, right? They have innovation. So I'm wondering, where is that innovation?
So, just so you know, real quick, today I was on the phone with Norwich Public Utilities and Groton Public Utilities. Again, in Connecticut, we have actually other models for how to run a power company. And if you look at Groton and Norwich, and I've been now, this is like the sixth major, disaster since I've been in Congress. Every single time, Groton and Norwich basically have less interruption of services, and they have much quicker restoration. And part of the reason is because they haven't cut their staffing in terms of linesmen to the bone. They don't have to rely on calling out to Canada, to get their power back on. And they also build in some redundancy in their systems that are there. And their rates, by the way, are lower than Eversource. So when the Pura does this new investigation, I wrote to the chairman on Friday basically saying, you know what, every single storm, these guys outperform Eversource and United Illuminating. It is time to use them at least as a measuring stick in terms of, staffing levels, and what are they doing that's so much better in terms of avoiding the interruption of service to begin with.
Right. Well, yeah, this is a critical point, I think. They're clearly understaffed. They weren't here for 3 days.
Right.
They had a program before where they assigned crews to come in early to work with Public Works. That had been scrapped when Eversource took over. But the other stories, we're finding out now that one of the reasons that why it was so late in Hebron is because there was a poll in Glastonbury that Frontier and Eversource were arguing over whose poll it was because it had snapped. And it took more than a day to resolve that. And I mean, that's not good management, right? I mean, that is not good management. Okay, I guess at this time, I'm going to open it up for questions from our audience, if there are any.
So, John, there was a question about test kits for COVID-19, and if we are not able to speed up the testing, the process of the tests themselves, is there a way to increase the amount of laboratories that are handling the tests?
So, I mean, that really in some ways is almost the question of the day. I mean, there is some new antigen tests that are coming in that are quicker. But I mean, I could just tell you a story that my son lives in New York City, and he wasn't feeling that great about 3 weeks or so ago. And he had a test. It took 18 days. And it was Quest Laboratory to get the test results back. So he basically quarantined for 2 weeks. And it turns out it was negative, thank God. But I mean, the point is that, if you can't get a test back in 72 hours or less, I mean, you're really at some point starting to defeat the purpose. And
right. Absolutely.
And so, again, this is the Defense Production Act issue, which I mentioned earlier, John, which is that the government actually has some pretty sweeping powers in terms of, really almost, nationalizing, companies that maybe are in a certain have a certain capability. And again, that's kind of what we did with the ventilator. It wasn't quite as big an undertaking. You didn't need the vast numbers of test kits that we need if we're a country this big. And again, the HEROES Act, we passed that back in May. Right. And it was focused on precisely this point, and we were doing it because we were listening to public health experts, not Peter Navarro or some of these other characters in the White House.
Right.
And it's just going to hinder and slow down the ability of this country to get over this. And there's money out there that I think provides some market signal that I think will boost production for, by some of these companies. But all the projections show we are still going to be falling short of really the volume that in my opinion, the experts say we really need if we're going to really have a comprehensive testing and tracing program.
So right, and there's resistance to it on the Republican side because they think it's socialist or something like that. But I was an environmental consultant. I have a PhD in soil chemistry, and I used to work on insurance cost recovery for large clients, and one of them was Dow. And I had to go through historical records, and what it became clear was that in the Second World War, Dow was completely nationalized, and they developed some of the most important products that won the war. They developed a gasoline with high benzene content that actually fueled the Spitfires that made them high performance planes. But the history's out there. After the war, they went back to being purely capitalist companies, right? I mean, they did their thing, for us in a crisis, and then they went back to being private companies. That's a model that we should be using, it seems to me.
Right.
So, Diane Greco has a question. Diane, would you like to unmute? You need to unmute.
Yeah.
There we go.
I was curious about the recent executive signing of the payroll tax and its impact on Medicare and Social Security.
Well, thank you for asking that, because I actually think it's a really harmful event because, as I mentioned earlier, the trustees report that came out last year for Medicare shows that we're already, within this decade, going to be hitting a tipping point in terms of the Medicare trust fund, and Social Security is a little better, but not much better. And the payroll tax obviously is one of the pillars of making sure that we at least don't go backwards as far as those solvency projections. If you read the order, and I, again, was reading another analysis before the call here, employers are almost in an impossible position, even if they wanted to implement this, because it's really a deferral, not a cut of the employee's tax, which means that there's going to be a balloon payment at the end of the deferral to sort of recover it, which I guess in some ways you'd say, well, at least that's good for the Social Security system. But is someone really going to, implement that? And the employers are worried that they're going to get stuck holding the bag in terms of, because the obligation is them. They have to administer it, as you probably know, in terms of the payments and whatnot. Trump actually did make some statements that he would like to make this a permanent program, which if that was the case, I mean, then really we're in big trouble as far as Social Security solvency, which, in my opinion, they have willfully been trying to pursue for years, in terms of trying to destabilize the system and then create a false crisis, that would push the system towards privatization. John Larson, has the Social Security for the 21st Century Act, which I'm a co-sponsor of. John is the chairman of the Social Security Subcommittee on the House Ways and Means Committee, which is just a really important position. And if Joe Biden is the next president, I think, we really are going to have some real movement towards not just protecting a tax on Social Security, but actually really getting some policies out there that really reinvigorate the finances and actually, fix some problems that exist right now in Social Security. But I'll tell you what, Trump was always very careful when he was talking about Medicare and Social Security during the presidential debates in 2016. And he's always been very careful about, because obviously a lot of his base are older voters. But what he did with that executive order is something that Democrats should not, hold back on, because they really, once again, are showing their DNA, which is a hostility towards these programs.
Well, I mean, if he makes that permanent, it means that he's usurped the entire legislative branch and our Constitution's in shreds. But that's not the first thing that he's ever done.
Judith Denberg had a question. Judith, would you like to unmute?
One of the things that, well, a lot of things bother me, but this whole COVID thing, you have test X, you have test Y, you have labs that can't handle things. Why isn't there a pressure to either expand the labs that exist or build new labs? And why isn't there a push to having one standard test? You have Trump getting tests that will come back in 15 minutes. You have people like somebody else here that took 15 days. I took a test my first test that I took was 48 hours. The second test was something like 7 days. And it just seems like there has to be one test so you can combine or compare apples to apples. You need to know this test is reliable, this test is not reliable. You need to be able to go to a lab and know that you're getting the same test that everybody else is.
So, I mean, that is a great question. And if you go back to when we passed the CARES Act last March, one of the last issues that we fought over, because again, there was some pretty, significant funding for testing that was in the CARES Act. But we also wanted a provision in there that really created a centralized, you'd almost say testing czar. I mean, where there really is, a person who is truly accountable for all of the various items that you talked about, Judith. And because right now it is very fragmented between, Health and Human Services, you've got, Homeland Security, FEMA, they're all sort of running around doing different parts of this whole initiative, but there really is no centralized, coordinated, clearinghouse for setting the standards and trying to get some coherent policy. The Trump White House just vehemently opposed having a provision like that in the CARES Act, and Pelosi and them, I mean, they were just could not believe it. But this whole push to try and get decision making down to the state levels, in terms of reopening and school standards. I mean, frankly, it's all part and parcel of his basically desire to not be responsible, for the sort of real nuts and bolts of governments. And so the HEROES Act, once again, we put in language to force the issue in terms of trying to create that sort of centralized decision making and accountability, in terms of just how this stuff all operates. We had vastly greater resources than what Mitch McConnell's bill had for testing, that the Republicans finally spit out about 11 weeks after we passed the HEROES Act, and that's going to be another one of these sort of knockdown, drag out fights if we get to a final negotiation.
So I mean, one of the issues we have is a president that doesn't really understand science. So his thing is, if you test more, you have more cases, and that's
right.
a fundamental problem with public policy. One of the things that if we look at situations that work, South Korea, 55 million people, they have 300 COVID deaths. We have about 6 times their population, about 6 times, but we have 170,000 now, or close to deaths, which is about 500 times more. But what they did is that they had an intense testing program from the beginning. And so with leadership, with real leadership, we could have mitigated this problem.
We had a really interesting hearing on armed services, back in April, with the general who's in charge of our troops in South Korea. And we got into a really interesting conversation because, they were part of the South Korean testing program that was there. And they did actually, identify a couple of soldiers who tested positive. But again, because, there was a real system over there in terms of, okay, this is what you do next,
right.
And then, they had the capacity to do retests. Again, we have about 29,000 troops over there with their families, a lot of them. And, again, they're part of that success story.
Excellent.
It's ironic, though, that they took care of our guys.
Yeah. So, go ahead, John.
So, Congressman, a couple of things which didn't make it into the Affordable Care Act was the public option.
Right.
And there's been some talk of trying to do something like that here in Connecticut. I know that Kevin Limbo, our controller, has been pushing for that for a long time. Can you talk about that concept and what the possibility would be if we were able to gain control of the Senate in the next Congress, if we could move forward on something like that?
So again, if you actually look at the bill that came out of the House in 2009, before it went to the Senate for final passage, we actually did have a public option that was in the bill. I remember well the CEO of Aetna Insurance Company screaming at me on the phone when we were getting ready to pass it. And I think this, John. I mean, despite all of the sort of Republican intuitive reaction, the public option actually saved the taxpayers money in terms of it would be cheaper in terms of the premium, and therefore the tax subsidies that are built around the Affordable Care Act would also cost less. So right off the bat, you would help the federal deficit by passing the public option. That's obviously, that is part of Biden's platform, in terms of, doing a public option. Again, there's other ideas about using Medicare as the public option, in terms of whether you lower, the age of buy-in or eligibility. Again, still being able to use Obamacare subsidies to lower the premium costs. Again, every time you run the traps in terms of, what does that mean in terms of dollars and cents, it's very beneficial, not only for the overall healthcare spending in the U.S., but also, it's beneficial to the families and individuals who could have that option available to them. So, really, that's one of those issues that's on the ballot this fall. When we started the journey for the Affordable Care Act in 2010, as I think many of you remember, we had 60 votes in the Senate, which was a great place to be. We unfortunately lost the Massachusetts seat after Senator Kennedy passed away. And frankly, I think that some of the final negotiations, because we only had 59 votes in the Senate, actually made the ACA less attractive, and things like the public option fell off the table when the final passage took place there. So, but again, but from a fiscal standpoint, an affordability standpoint for patients, it really screams out for action. And again, the fact that our national platform is embracing it, I think, is really something that people should really be very vocal about. When the ACA exchanges were set up in Connecticut, again, I used to go to the enrollment sessions, and it was very moving for people who had no insurance to suddenly, have that door open. But there was that slice of the population over age 50, because there is still some age rating in the ACA exchanges, who it was very expensive, to get a gold plan, silver plan, bronze plan. And that's that's really why a public option is just so important, because it still was pretty expensive for people, even though, again, you had all the patient protections of the ACA.
I was talking to a state rep candidate that we're also working with today. He's got a family of 4. He's got a bronze plan, so he's down at the bottom. $24,000 a year for the premium, plus $11,000 more for deductible. Yeah. So $35,000 a year to protect himself against catastrophe. But basically, he's paying for all of the health care for his family out of pocket.
So let me
and if you fall off that ledge in terms of getting a subsidy, you are that guy is a poster child.
It also has an effect that people I don't think talk about, because it happened to me. With health insurance tied to your employer, if you're an entrepreneur and you want to start your own company, you're scared when if you quit your job, because you have no health care, and you're borrowing money, and you have a family. That happened to me. I was like, well, we did it, but it was if we supported entrepreneurs, it would do so much for the economy, I think.
True.
So one thing I want to talk about, because it's one of my pet issues in Hebron, we are actually the first community in the state to replace our pipes in our elementary school. And the reason why we did it is because there was lead contamination. The school goes back to 1948, and last year EPA came out with a guidance that just said all lead is bad for children. There is no safe level. But we had a treatment system that wasn't working. Board of Selectmen passed a resolution. Mal Leichner, right here, is our basically the project manager on it, and we've replaced the pipes. And like I said, we're the first in Connecticut. Lead is so bad for children, even a little bit. It's people think that the existing threshold is health-based. It is not. It is based on practicality of what you can do. The actual threshold, what should be, is about 2 parts per billion, and very few schools have that, make that thing. So, one of the things I want to do when I go to the legislature is talk about lead. I want to make sure that that schools are flushing every day, especially older schools. And then also, if we have very old schools where we have flaking, we need to start replacing some of those pipes, because it is costly, but the impact to children, especially small children, is so evident. I mean, they lose measurable IQ points just by exposure from drinking water.
So one thing, again, just to throw it out there. So HR 2, which we actually passed about a month ago, which is an infrastructure bill. Actually, a piece of the bill was the Rebuild America Schools Act, which would, again, expand the definition of what is infrastructure to not just be, roads and bridges, but also school buildings. And again, the formula is very much focused on Title I as sort of the neediest school districts that would be eligible for that type of assistance. But it's another example of where it passed the House. If we actually had a Senate that was, cared about, real issues that, by the way, would really help the economy, in terms of infrastructure investment. And obviously Biden is very much gung-ho in terms of moving a real infrastructure bill forward. So, but one of my best friends in Congress is Dan Kildee from Flint, Michigan, where they went through the lead poisoning there for the entire water system there. And I mean, we were getting updates as this thing was unfolding. And I mean, your point about the threat that lead poses is absolutely, definitely true.
And it's like Flint, the concentrations were, astronomical. I mean, how they didn't know that is beyond me, but it really happens a lot in poor neighborhoods too, because schools are older and maybe the testing isn't as good. But it's important to inner cities, but it's also important to rural communities. And it's just not, people don't know, people don't know. So here we've replaced our pipes. We got half of it reimbursed by the state, which was great. We showed that it was, that it was worthy of that. Our other school we're flushing every day, which is important. So.
Right. Good. So I have to do this with the Madison Democratic Town Committee in about 10 minutes, or actually 5 minutes.
Okay. Well, thank you very much for coming, Joe. And it was very informative. And I hope to see you on the campaign trail.
Yeah, no, anything I can do to help, let Brian know. And, again, we've all got to figure out this new sort of reality that we're in right now. But, I'm feeling very bullish about 2020, but obviously we got to execute and do our job.
Yeah, we have to execute, be disciplined, and we have a really good shot here, I think.
Yeah. Okay, well, again, good to see everybody.
Big thanks to Brian and to Charlotte Nelson for setting this up.
Okay. Thanks, Charlotte.
Thank you, Charlotte. And thank you, Brian. Yeah. I want to thank all the participants too. Really great questions. Stay tuned to next week. We're going to have another town hall at 6 o'clock.